स्वयं का होना।
हाँ, हो जाए तो बहुत बढ़िया। हेलो। हाँ सर। अभी कल ही करेंगे, चलो।
Hello everyone. We are just waiting for our referee to join. We'll be beginning shortly. Meanwhile, I request all the participants to kindly turn on their video feeds and keep their microphones on mute mode. Thank you.
वीडियो अभी
तो चलते हैं।
नहीं कर दूंगा. Shall I start the video? नहीं कर दूंगा. Shall I start the video?
अब नहीं है। Start.
Good afternoon, everyone. Good afternoon to all my colleagues, friends, juniors and seniors from the fraternity. So we are starting with the CEREBRA 2024 finale. Just to give a brief introduction about CEREBRA, this is the second edition of CEREBRA that we are conducting. Last edition was conducted in 2022. This quiz has been organized by the Department of Psychiatry, MGM Medical College, Indore, Madhya Pradesh. And just to give you a bit brief, this quiz was conducted in two sessions. First was the screening round, which had around 225 participants from all over India. We had participants from over 86 medical colleges, from 25 states and union territories. And I congratulate all the participants which are currently joined with us, that you are amongst the top 15 and you have been selected because of your talent, your knowledge, and your presence of mind. So we begin the CEREBRA 2024. I wish you all the best. Just to give a brief info about our head of the department. Shall we start the PPT?
इसमें आया क्या?
PPT. Are we audible? Yes. So this quiz was conducted under the guidance of Dr. V.S. Pal, who is the head of the department, professor in the Department of Psychiatry, MGM Medical College, Indore. Under his guidance, we have conducted this second edition of CEREBRA 2024. Next slide, please. The referee for this quiz will be Dr. Swayam Prabha Baral. She is a consultant psychiatrist from Puri, Odisha. Dr. Swayam, do we have you with us?
Yes, sir.
So
Good
Dr.
afternoon.
Swayam is a young influencer psychiatrist. I think most of you must be knowing her. She is the founder of Swayam Mind Clinic, and we are proud that she is associated with this quiz as a referee. In case of any query or any discrepancy, the decision of the referee would be considered final. So with your permission, Swayam, shall I proceed ahead?
Yes, sir. Please, sir.
Thank you. Thank you so much. To give you a brief about the organizing committee, the quiz masters, I am Dr. Rahul Mathur. I am consultant psychiatrist here in Indore. We have organized this quiz with Dr. Varchasvi Mudgal and Dr. Priyesh Jain. Both of them are associated with our department as consultant psychiatrists. Can we go ahead? So just to introduce the finalists, can I request all the finalists to kindly introduce themselves? Dr. Aditya Suresh, do we have you with us?
Yes, sir.
So Dr. Aditya is from Central Institute of Psychiatry. Dr. Aditya, please introduce yourself.
Good morning, everyone. Good morning to the judges, the referee, and my fellow contestants. I am Aditya from CIP. I'm a final year junior resident. And best of luck to everyone. Thank you.
Thank you. Thank you, Dr. Aditya. Then Dr. Amit Patel from SSMC Riva.
Good morning.
Amit, are you there?
Yes, sir. Good morning. I'm Dr. Amit Patel, third year PG resident from SSMC Riva. And I wish all the best to all the finalists.
Thank you so much. Dr. Avijit Batra from SMS Medical College, Jaipur. Dr. Avijit, can you introduce yourself, please?
Yeah, good morning, sir. My name is Dr. Abhijit Batra. I am a third year junior resident at SMS Medical College. And best of luck to everyone. Thank you.
See it. Dr. Bias Kole from IPGMER SSKM Hospital, Kolkata. Dr. Bias, can you hear us?
Yes, yes.
Please
Good
introduce
morning,
yourself.
everyone. Good morning, everyone. Myself, Dr. B.S. Kole, final year PG from Institute of Psychiatry, IPG Medicine Scheme, Kolkata, and I want to wish everyone all the best. Thank you.
Thank you so much. Welcome to CEREBRA 24. Now, Dr. Dhwani Parekh from GCS Medical College Hospital and Research Center. Dr. Dhwani, please introduce yourself.
Good morning. In GCS Medical College, I'm third year postgraduate resident, and all the best to every contestant. Thank you.
Dr. Dhwani, I would like to inform that your voice was breaking a bit. I would request you to kindly check your internet connection if that's possible.
Okay.
Yeah. So welcome. And now Dr. Jaswant Sikha from Central Institute of Psychiatry. Dr. Jaswant, do we have you with us?
Yes, sir. Yes, sir. Good morning, everyone. I'm Dr. Jaswant. I'm second year junior resident in Central Institute of Psychiatry. I wish everyone all the best. Thank you, sir.
Thank you so much. Next participant, please. Dr. Kashyap Shah from MGMMC Indore. Dr. Kashyap, are you there?
Yes, sir. A very good morning to one and all. Today, it's a great pleasure to be a part of this quiz, and I would wish all the best to all my fellow contestants. Thank you, sir.
Welcome to CEREBRA 24. Dr. Manisha Menon, please introduce yourself.
Good morning, everyone. I am Dr. Manisha Menon, third year psychiatry resident at MGM Medical College, Indore, and I wish everyone all the best. Thank you, sir.
Thank you. Our next participant is Dr. Pavitra from Lady Harding Medical College, Delhi. Dr. Pavitra, please introduce yourself.
Good morning. I am Dr. Pavitra, a third year resident from Lady Harding Medical College, New Delhi, and I wish all the best to all the participants.
Dr. Pavitra, your video, we cannot see. Can you please switch on your video, please? So I would request all participants from here onwards, please do not switch off your cameras. Please do not stop the video. This is very important. We'll be monitoring you all. And I would also request you all to kindly keep your second devices ready from which you'll be playing on the Kahoot. Please keep the devices, the second device also ready. We would request you to kindly just make it visible on the video whenever we tell you to do so. Dr. Priya Katfar from MGM Medical College. Dr. Priya, have you joined with us? Dr. Priya? Okay, Dr. Priya has not joined with us, I guess. Dr. Sahil Agarwal from Guwahati Medical College. Dr. Sahil, do we have you with us?
Yes, sir. Good morning to one and all present here. Myself, Dr. Sahil Agarwal, final year postgraduate trainee, Guwahati Medical College and Hospital. And yeah, very all the best to one and all.
Welcome, Dr. Sahil. Dr. Salmali Nandi from Medical College and Hospital, Kolkata. Dr. Nandi, do we have you with us?
Yes, sir. I'm Sharmini Nandi from Medical College and Hospital, Kolkata. So I'm a second year junior resident. I want to wish all the best to all the contestants.
Our next participant is Dr. Priya Katfar. Dr. Priya, have you joined? I think we can only give her 2 more minutes.
She has not waited. She has not unmuted.
Has she joined?
She has joined.
Okay. Moving on to the next participant. Dr. Saloni Mishra. Dr. Saloni is from MGM Medical College, Indore. Dr. Saloni, please introduce yourself.
Yes, sir. Good morning, everyone. I'm Dr. Saloni from MGM Medical College, Indore. I wish everyone best wishes for this quiz. Thank you.
Welcome, Dr. Saloni. I would request our team to kindly see if all the videos have been switched on. Dr. Simranjeet Kaur from ABVIMS and RML Hospital, New Delhi. Dr. Simranjeet, have you joined?
Yes, sir. Good morning, everyone. I'm Dr. Simranjeet Kaur, third-year resident from RML Hospital, and all the best, everyone. Thank you.
Our next finalist is Dr. Vaibhav Singh from KGMU Lucknow. Dr. Vaibhav, please introduce yourself.
Good afternoon, everyone. I'm Dr. Vaibhav, third year junior resident at KGMU Lucknow, and I wish all the participants a very good luck.
We welcome you to CEREBRA 24. So here we come at the end of introducing the finalists. Has Dr. Priya joined?
We're just checking that.
Okay, we'll give her 2 more minutes. If not, then we'll continue with the 14 last finalists. So just to brief all the participants, the final round of CEREBRA 24 will have 5 rounds, and each round will be having 10 questions each. So there are a total of 50 questions. And just to inform you all, every round will have a single bonus question where points will be doubled. I hope that's clear. The scoring is dynamic, which means that as soon as you answer, as quickly you answer, the more points you get. I hope that's clear to every participant. There are a maximum of 1,000 points to be grabbed per question. So total of 50,000 points are there to be grabbed by for all the participants. If there is, and it will be conducted on Kahoot. I think the demo round has been conducted. So all of you, I hope you are okay and familiar with the platforms that we are using. Dr. Simran from RML, please switch on your video, please. I request everyone that from here onwards, please don't switch off your cameras. This is very essential. It is required. And if any time the video is seen as off, the points may get cut and it might even lead to disqualification. Right? I hope you're all clear. If there are any doubts, if there are any questions, if there is anything that you wish to understand, now is the time you can ask it. You can raise your hands and you can ask if there are any doubts regarding the format of this quiz.
Good morning.
Yeah. Please tell me. Yes. Dr. Priya, please introduce yourself.
Yes, sir. Yes, am I audible?
Yes, you're audible.
Good morning, everyone. I'm Dr. Priya Katkar. I'm from MC second year PG resident. Wishing all the best to every finalist.
Right.
Thank you.
Just to be clear again, from here onwards, nobody can switch off their cameras. I would request everyone to kindly flash the, kindly join in the Kahoot platform. The game pin has been displayed to you all. We currently have 11 people who have joined. Not all people have joined. Dr. Manisha, Dr. Avijit, Dr. Kashyap, Dr. Sahil, Dr. Saloni, Dr. Vaibhav, Dr. Bias, Dr. Aditya, Dr. Simranjeet, Dr. Pavitra, and Dr. Amit has joined. Dr. Dhwani has joined. Dr. Jaswant has joined. So now we have 14 participants.
16, 13 is the control.
Okay.
It's
We
been
have everybody on board on Kahoot.
it's been shown that when I'm trying to enter through Kahoot, it's being shown that there's something wrong with the pin.
Kindly retry it. 677230. Kindly
Yeah.
retry it.
Okay.
Who else is left? Dr. Nandi and Dr. Priya. But let them join, then I can. Dr. Nandi, are you able to join?
I'm still trying. Just a minute.
Kindly check your internet connections. As this quiz has dynamic scoring, any problem in the internet connection at your end will lead to you scoring less marks. So I hope that was clear. It was made clear in the demo itself. I hope you guys have checked your internet connections. So we are just waiting for Dr. Nandi. Dr. Nandi, is there any problem? Can you share with us?
That's the same thing. I'm being unable to. I'm just go into Kahoot once again.
Could you just like log out and then again retry it?
Yeah.
Reopen the browser. Reopen the browser.
Yeah, that's what I'm trying to do.
Okay. Or could you do one thing? Could you try on a different device? Maybe on a cell phone?
Yeah, okay. Just.
Was she there in the demo? In the demo, were you able to join?
Yeah, I was able to join.
There is a QR code too written against like just near to the.
Yeah, I think it will work.
Yeah, she's it.
Yeah.
Okay, so we have all the participants on board. Just before starting, I would like to tell you that if in case because of your internet connection you get logged out, you can again try to re-log in. But during this while, you will suffer on your points because of your internet connection. So kindly make sure that you have a good active internet connection. But due to any problems, if you do get logged out, don't panic. Try to re-log in again with a different username. If you re-log in, you will not be able to join with the same name that you had done previously. What we'll do is, in that case, we'll have to figure out the new scorings will be shown, but don't panic. We'll combine these scorings and then we can again, we can compile the results later. So try that your internet connection is active throughout the quiz. If in case any problem happens, we'll figure out the solution for it. Right? We have one participant missing right now. Who is it? Priya. Dr. Priya, you are not there. We'd like to begin. You can join whenever you are able to. Right? We should start now.
Yeah, she's also here.
So, okay, participants, let us begin with the CEREBRA 2024. I would request Dr. Priyesh Jain to kindly begin with the round one. Dr. Priyesh, kindly continue, please. I hand over the platform to Dr. Priyesh. Please continue.
Thank you, Dr. Mathur, sir. Once again, all the best to all the contestants over here. We'll be beginning with the first round shortly. The first round will have MCQ questions with each question having a single correct option. Again, the quiz, the first round has all of the rounds have dynamic scoring pattern. So you have to answer as fast as possible to score more marks. Next, please. So the first round is just about warming up. We'll be asking you 10 different questions. As was told prior, one of the question will be having a double scoring, and that will be displayed before that particular question, that this particular question has double scoring, so that you can try and try to score more if possible. So we'll begin with the question. Round one, it begins. All your hands on the phone. Third hand smoke can be best described as. Your options are okay. So the correct answer is residual nicotine and other chemicals left on the indoor surfaces from the cigarette or other tobacco burning devices. They might seep into
Hello.
materials like hairs,
Hello.
clothes, furniture, carpets, and then they get absorbed back into the environment and can be inspired while
Excuse me, sir.
inhaling or breathing. So the correct answer is B.
Excuse me, sir.
Yes, Dr. Priya?
Sir, I'm not able to get the question on my Kahoot app.
Just a second. What is the problem that you're seeing?
सर क्वेश्चन डिस्प्ले ही नहीं हो रहा है Kahoot ऐप पे मतलब बस राउंड 1 लिखा है
log in again, like kindly log in again. It's okay. Kindly go back to kahoot.it and log in again.
Dr. Priya, that there seems to be a problem with your internet connection. Try to rectify it. Otherwise, you might suffer on the scores. We would like to continue with the quiz, please.
Yeah, we'll be continuing with the quiz for now.
सर 1 minute.
Okay, so we'll be beginning with the next question. Question number 2, the first round is a historical endocrine therapy for the treatment of psychiatric disorders used which of the following agents? Your options are fluoroethyl ethane, sevoflurane, isofluoroethyl, or diethyl ether. Okay, so the correct answer is fluoroethyl ethane. 4 of you got the answer correct. Can anybody from the participants volunteer and tell us about more about endocrine therapy? Okay, so the endocrine therapy is one of the historical procedures in psychiatry, which was used, which is kind of outdated right now. It is not used. It used fluoroethyl ether as a substance that used to induce seizure. It was equivalent of ECTs during that time. But given the side effects, the nature of side effects that people used to experience, the therapy was discontinued. So this was one of the questions that was based upon history of psychiatry. We'll go on to the next question now. Just a second.
So I would request you all, if there is any problem at your end in the app or during the question, please do not interrupt in between the quiz. Kindly raise your hands. We can figure out at the end of the question. This stands true for throughout the quiz. So please don't interrupt other participants in between the quiz. You can raise hands or put it in the chat box. If there is a problem at our end, I guess all the participants would be suffering and we would come to know. We have a solution in that case also. But if there is an individual problem at a single participant end, I think we'll have to continue with the quiz. Please continue, Dr. Priyesh.
So we'll begin with the next question. Third question of our first round. Which of the following is not a component of OARS, OARS, used in motivational interviewing? So the correct answer over here was reorganization of thoughts. OARS is one of the main component of motivational interviewing. It is a set of skills that the motivational interviewer must use. The interviewing technique was first devised by Miller and Rollneck. OARS is an acronym that stands for open questions for O, A for affirmations, R for reflective listening, and S for summarizing. So here, reorganization of thoughts is the wrong answer. So we'll begin with the next question. Question number 4 of round first. This has double marking as well. So please be cautious while you answer. Madonna-Putana complex refers to? Okay, so of all the answers, the B, inability to have sexual intercourse with a particular partner, is the right one. Can anybody from the audience volunteer to tell us more about Madonna-Putana complex? Does anybody know about it? Okay, so nobody. Again, Madonna-Putana complex also refers to Madonna-Mistress complex. It is one of the Freudian psychoanalytic ideas regarding the sexual intercourse among humans. The Madonna here refers to a saintly figure, while the Putana refers to someone, a debased individual. So here the individual sees the woman either as somebody, a saintly figure, or a debased individual, so they are not able to have intercourse with particular partners. So the correct answer was inability to have sexual intercourse with a particular partner. We'll begin with the next question. Question number 5 of round 1. With respect to post-ictal psychosis, which is incorrect? You have to select the incorrect one. Question is regarding post-ictal psychosis, and you have to select the incorrect option. So the correct answer over here is onset within 1 day of seizure. This derives from Loxdale and Toon's criteria. Loxdale and Toon described the criteria for post-ictal psychosis. The episode of psychosis should develop within 1 week of seizure. Hence, the first option is incorrect. It is within 1 day. The correct would have been within 1 week. The second is psychosis lasting at least 15 hours or less than 2 months. Rest of the answers were like history of mood disorder were also correct. So the scoreboard right now, Dr. Simranjeet Kaur is leading with 4064 score. And the next on second rank is Dr. Dhwani Parekh with again 4036. And on the third position, we have Dr. Pavitra at 4020 scores. We'll begin with the next question, the sixth question of the round 1. Which of the following is not a feature of Binswanger's disease? Not a feature of Binswanger disease. Your options are rapidly progressive dementia. B, clinical signs may include Parkinsonian syndrome, fluctuating mental state is seen, and deep white matter demyelination in periventricular areas. Okay, so only 3 of you got it correct. The correct option over here is rapidly progressive dementia. In cases of Binswanger disease, gradually progressive dementia is seen. It is not rapidly progressive. Rest of the options are correct. It may include Parkinsonian syndrome, fluctuating mental state may be seen. And on neurobiological level, there is deep white matter demyelination in periventricular areas. So the correct answer was A. We'll begin with our next question, question number 7 of round 1. Consider the following statements and choose the most appropriate one. Paroxetine is safe in pregnancy as an antidepressant. Clozapine is a category C drug. Valproate is safe in breastfeeding. MAO inhibitor can be safely given in pregnancy. You have to choose the most appropriate one, the most correct one of all the following. The correct option over here is, the correct answer over here is Valproate is safe in breastfeeding. For option A, paroxetine is considered to be unsafe. It has been known to cause cardiac malformations in the fetus. Clozapine is a category B drug. Again, it's not a category C drug. It is a category B drug, which is why it is incorrect over here. Valproate is safe in breastfeeding because there is less than 2% maternal plasma levels in the infant is achieved, which is why valproate is considered to be safe. MAV inhibitors cannot be given safely in pregnancy because they are known to cause malformation in the fetus again. So correct answer over here is C. Valproate is safe in breastfeeding. We'll begin with the next question number 8 of our round 1. Which of the following is incorrect in context of Willis-Egborn syndrome? Option A, female are more commonly affected. Option B, dopaminergic agonists are effective. Option C, symptoms generally worsen at night. And option D, autosomal recessive inheritance is seen. The incorrect in context of Willis-Egborn. So the Willis-Egborn is also known as restless leg syndrome. It is another name of restless leg syndrome. It is a neurological disorder, usually chronic, which is characterized by an overwhelming urge to move one's legs. This urge is usually felt at night, so it makes difficult for the person to sleep. Dopaminergic agonists are effective treatment strategy. The genetic preponderance of the disorder is autosomal dominant, not autosomal recessive. 60% cases are inherited in autosomal dominant pattern. So over here, autosomal recessive is the incorrect one. Hence our answer is autosomal recessive inheritance. I request to continue with the next question. Let's start with the question number 9 of round 1. The term matrix refers to the term matrix. Is it a classificatory system of mood stabilizers? Is it a clinician administered question for sleep disorder? Is it a construct of assessment and improvement of cognition in schizophrenia? Or is it a rehabilitation model where remitted patients live under supervision? Okay, so most of you got it right. It is a construct for measure for assessment of improvement of cognition in schizophrenia. Can anybody from the participants volunteer to give the full form of matrix? What does matrix stand for? It looks like nobody is willing to volunteer for the answer, although most of you got it correct. Matrix stands for measurement and the treatment research to improve cognition in schizophrenia. It is one of the NIMH initiative. So it is to improve cognition, research to improve cognition in schizophrenia, which is one of the less treated aspect right now. So we'll begin with the next question. The last question, the ultimate question of our first round. On your screens, choose the incorrect option in context of Tapes dorsalis. Is it a late consequence of neurosyphilis? It was described by M. Romberg. It involves lateral column tract and it is treated by aqueous penicillin. You have to choose the incorrect one. So the correct answer over here is involves lateral column tract. It is the incorrect option. The giveaway is in the name itself. It's Tapes dorsalis. So it involves the dorsal column tract, not the lateral column tract. So correct answer was C. It involves the lateral column tract. So here is the scoreboard. By the end of our first round, Dr. Vyas Kole is leading us with 649 points. Dr. Simranjit Kaur is on the second position with 6612 score. And Dr. Abhijit Batra is on the third position with 6090 score. So before we begin with our next round, we have some audience questions as well. The questions will be posted in the YouTube stream. So here are the questions for the audience.
So we have the first question. It will be, can I request Dr. Vachesvi to kindly give the audience round, please? Yeah. So good afternoon to everyone. Just a breather in between the two rounds. The question for the audience is,
Which of the following drugs is responsible for causing greater than 10 milliseconds of QT prolongation? The options are olanzapine, clozapine, quetiapine, and risperidone. The fastest one to answer will be eligible for a prize after the quiz has been completed. The question is visible on the YouTube chat. Okay, so the time is up for the first question. The second question is, which of the following is not a type of autoscopic phenomenon? The options are positive autoscopy, inner autoscopy, heotoscopy, and out of body experience. So back to you, Dr. Priyesh. The answers for the audience questions will be given after the end of second round. So Dr. Priyesh, kindly proceed with the second round. We have scores with us. Dr. Biaskole is leading, as Dr. Priyesh has already said. We have the top 5 list displayed in front of us. There are still 4 rounds left. There are a lot of points to be grabbed. I request every participant to be on their toes. This is dynamic scoring. You have a lot of chance to still reach to the top. So Priyesh, please continue with the second round, please. Thank you.
So we'll be beginning with our second round. The round is media mogul. So we were asking for our promotional content, we were asking a lot many things like what are the extracurricular activities that you're involved in. We didn't get anybody who said Netflix and chill. So if anybody had this Netflix and chill as an extracurricular activity, they would have definitely been a mogul in this round. So we'll begin with this, with the first question of this round. We'll be having an image on the screen. You have to see the image and you have to answer accordingly. The image again can be zoomed on your phone screens. The first question is, the theory expounded in the book below is it transactional analysis? Is it game theory? Is it object relations theory? Or is it Gestalt theory? So the correct answer is transactional analysis. The book was by psychiatrist Dr. Eric Berne. It introduces the concept of transactional analysis, which is a way of interpreting the social relations, social interactions. The game theory is one of the theories, applied branches of mathematics. Object relations theory was by Melanie Klein, and Gestalt theory is part of Gestalt psychology. So the correct answer was transactional analysis. And we'll have a second question on our screens. Everybody get ready with their phones in their hands. Select the most appropriate of the following with respect to the picture given. You have to select the most appropriate with respect to this picture that is being shown. Your options are Vincent van Gogh, Louis Wayne, Edgar Degas, or Stephen Wiltshire. The most appropriate with respect to this picture. And the correct answer is Louis Wayne. So 5 of you got correct. Is anybody again daring enough to volunteer and explain what this picture is about? Anybody who got the answer correct? I had to dare, but again, nobody is volunteering. So the picture was by Louis Wayne. It is a series of paintings. Louis Wayne was a famous painter who also had schizophrenia. And it was later hypothesized that as his mental illness progressed, as his schizophrenia progressed in its course, the nature of the cats in his painting got more and more abstract. So if initially the cat was very tangible, very concrete. In the later images, the cat keeps on becoming abstract and keeps on mixing with the environmental elements. So this is one of the theory regarding those series of paintings given. The correct answer was Louis Wayne. We'll begin with the next question now. Identify the correct labels. The image can be zoomed. You have to look at the image, you have to decipher what does it mean, and you have to identify the correct option of all the 4 given. So the correct answer over here was the second option. The first one is norepinephrine with its receptor being alpha-2A. The third one was dopamine with its receptor being dopamine 1, D1. It can be deciphered easily. This is one of the this is image depicting the neurobiology of ADHD. Here we can see that we have a weakened or lost signal when the third neurotransmitter binds with the fourth receptor. So this is the action of dopamine on D1 receptors. When dopamine binds with the D1 receptors, it results in weakening of the signal. And when norepinephrine binds with alpha-2A receptor, it results in strengthening of the signal. So here the end result that we see is weakening of the or loss of the signal. So the correct answer was B. First one being norepinephrine and the third one being dopamine. They being bonded with the receptors. So we'll begin with the next question now. Before we begin with the next question, I would request some of the participants do not have the videos on.
I would request all the participants to kindly show us the alternate device that you have. We would like to check the screens. Can you flash your devices? Second devices, please. This is a random check. Dr. Vaibhav Singh, your video is unavailable. Everybody they have, okay. Dr. Vaibhav Singh, please switch on your video.
My video is on from my side.
Yeah, please don't switch it off.
It was never off. Okay.
Kindly show us your alternate devices, please. Can you flash it once with the screen so that we can see that you're playing Kahoot on it? Thank you so much. Just a second. Please keep doing it. Our team is just checking it. Dr. Amit, can you show us your second device, please? Our organizers have taken a decision. We'll have to bar Dr. Priya from playing the quiz further. Can I request the quiz master to kindly bar Dr. Priya as her video is not available? With the permission of our referee, we have taken this decision. There will be only 14 participants from here onwards. We cannot allow Dr. Priya to play further.
Hello.
Shall I change, sir? Switch back.
Dr. Aditya, can we just see your device, please? Second device, please. The screen is not clearly visible. Are you playing on the same device? Yeah. Okay. Yeah. Thank you so much. Thank you. There will be random checks in between. I'm sorry, we'll have to do this just to be fair. Can we continue with the quiz further, please? With the fifth question, Dr. Priyesh, please go ahead.
So we'll be beginning with the fourth question of the round.
Just a second. Just a second.
Everybody get ready with their hands on their phones. You have to choose the correct option for the disorder detected by the image below. You have to choose the correct one. Image can be zoomed. Your options are cocktail sign, mangrove sign, Mickey Mouse sign, or hummingbird sign? You have to choose the correct one. So the correct answer over here was hummingbird sign. If you were able to zoom, you could have appreciated a hummingbird being visible near the hindbrain of the hind region of the scan shown. It is the sign seen in progressive supranuclear palsy. Mickey Mouse is another sign that is seen in progressive supranuclear palsy, but it is seen in the axial segments. It is seen in axial segments, not in the image shown. It was hummingbird sign or penguin sign, also known as penguin sign in the image. We'll begin with our fifth question of round second, the media mogul. Which condition makes up the central theme of the novel depicted in this image? Your options are schizophrenia, intellectual disability, autism, and dementia. If anybody is into reading, they might have read this book. It's one of the must-read book by a psychiatrist, Flowers of Algernon by Daniel Case. What is the condition that makes up the central theme of the novel depicted over here? So the correct answer over here is intellectual disability. Only 4 of you got it right. The book is based on intellectual disability, where our protagonist Charlie Gordon suffers from intellectual disability and is about to receive a procedure that is going to treat his intellectual disability and going to give him a kind of superhuman intelligence. So the series of events that unfold later on makes the theme of the series. The correct answer was intellectual disability, a must-read book for a psychiatrist. We'll begin with the sixth question of round 2. Okay, so the protagonist suffers from which disorder in the movie shown? We have a movie poster over here. The poster is of 15 Park Avenue, a film by Aparna Singh. You have to identify the disorder that the protagonist of the movie suffers from. So the correct answer here was schizophrenia. The movie is a famous Bollywood movie, where the protagonist Meethi suffers from schizophrenia, who is scared by her sister, who lives in a delusional world while she is married and she has 5 children and who she wants to meet. So the movie was 15 Park Avenue and the correct answer was schizophrenia. She suffers from schizophrenia. The correct answer was B. We'll begin with the next question, the 7th question of the quiz. It also has double scoring, double points. So get ready. You have to identify the highlighted regions and you have to identify what does these highlighted region make up. Your options are task negative network, task positive network, salience network, or central executive network. You have to first identify the highlighted regions and then you have to determine that what of all these networks, what does these highlighted region make. You can zoom in if you want. Okay, so the correct answer was task negative network. Only single correct answer. Task negative network is also known as default mode network, DMN. The structures were dorsal medial prefrontal cortex, posterior singular cortex, precuneus, and angular gyrus. It makes up the default mode network, which is also known as task negative network. Only Amit from SSM CEREBRA got it right. So kudos to you, the only person to get it right. We'll move on to the next question. The 8th question, identify the famous personality who once claimed Amitabh Bachchan to be an international gangster. So again, if anybody from you follows Bollywood, you will know this, a famous incident, and the personality is also quite famous. I think we have all the 15 answers, the quickest of all the questions. So the correct answer over here is Parveen Babi. A few of you got confused with Zinat Aman, but it was Parveen Babi. She is somewhat known to be suffering from schizophrenia. It was known in the media. She made some famous accusations against Amitabh Bachchan, Bill Clinton, Robert Redford, Prince Charles, or sometimes even government agencies like British government, French government, BJP government. And she made these allegations that all these agencies wanted to kill her. In another interview, in a famous interview in 1989, she also claimed that Amitabh Bachchan was an international gangster who performed a kind of surgery on her and planted a transmitter or a chip under her right ear. So that was Parveen Babi, famous personality who was alleged to have schizophrenia. The correct answer being D, Parveen Babi. We'll move to the next question, the penultimate question, the 9th question of our Media Mogul round. Again, we have another famous personality. This time, you have to identify the personality is associated with. Is it Schizophrenia Research Foundation, SCARF? Is it Gilhari syndrome? Is it Dhaat syndrome? Or is he founder of Indian Psychiatric Society? Again, most of you have come up with the correct with your options. I think all of you have registered your options. The personality, okay, this one is a simpler one. Can anybody from the audience volunteer and tell us about the personality? It's an easy one.
Any participant can switch on their mic and kindly identify this personality, please. Anyone from the participants.
I think we have a very shy audience. So the personality over here is
Professor N.N. Wig. Professor N.N. Wig.
Yeah, right. Dr. Vyas Kole has come up with a correct name of the personality, Dr. N.N. Wig. Can you also please tell us about some of the achievements by Dr. N.N. Wig? Okay, so he was the founder of the Department of Psychiatry of PGIMO. He also advanced the field of community psychiatry in India with his Raipur Rani block in Haryana. He also came up with the diagnosis of Dhaat syndrome for the Indian population. And he was also head of the department of AIIMS Delhi for a very long duration. So that was Dr. N.N. Wig. So we'll be beginning with the last question of our second round, the Media Mogul. The ultimate question. You have to identify the disorder depicted in this show. Very easy one if you follow all the series. And is it depression, autism, schizoid personality disorder, dissociation? I think we have all of the participants have registered their options. Okay, so anybody from the participants, almost everyone got the answer correct. Can anybody volunteer to tell us about the show? Okay, so the show is The Good Doctor, and the protagonist suffers from autism. He is a surgeon. He is known to have savant skills, and he's really very, very good at surgery. So that was the final question of our round 2. The scoreboard right now stands Dr. Vyas Kole is leading us at 12647 score, Dr. Pavitra on second, and Dr. Vijit Batra on the third. I request Dr. Rahul Mathur to take on the stage.
Dr. Amit is back in the lead. There are still 3 rounds which are up for grabs. Guys, please be on the toes. There are still a lot of points to be grabbed. There is still a lot of options for you guys. Thank you, Dr. Priyesh, for conducting the round 1 and round 2, our quiz master. Now, for the round 3, round 4, and round 5, we have our grand quiz master, Dr. Varchasvi, the dynamic psychiatrist, with us to conduct the further rounds. Before we do it, we have a few questions for our audiences.
Can I request Dr. Varshasvi, please declare the answers for the first two questions for the audiences, please.
So, very good afternoon to everyone. So, before we begin with our round 3, the answers for the audience questions, the first one was, which of the following drug is responsible for causing a greater than 10 millisecond QT prolongation? The answer is quetiapine. And the second one, which is not a type of autoscopic phenomenon, the answer is positive autoscopy. The results will be declared at the end of the quiz. So please, I request the audience to keep on following the quiz and be as enthusiastic as possible. The questions for our second round for the audience this time are, I have. Which of the following is not a factor as per the Cloninger's 7-factor model of personality? The question will be displayed in the YouTube comment section. The options are novelty seeking, cooperativeness, neuroticism, and harm avoidance. You have 20 more seconds to go. The first one to answer will be chosen as the winner for this question. The correct answer. As per precedence, the answers will be given in the next round, between the next 2 rounds. The second question for this round is, which of the following is not a risk factor for developing akathisia on the antipsychotics? The question is in the comment section. Options are older age, female, preponderance of negative symptoms, and vitamin B12 deficiency. So the fastest finger to answer will be, correct answer will be the winner. Okay, so
Answers for this question will be declared after the third round.
So I also, along with the participants, I thank our enthusiastic and numerous audience which is with us, following us. So let us begin with our third round. Yeah, due to as the policies were already discussed with you yesterday regarding the video, Dr. Priya will have to remove you from the race of this quiz due to your technical error or whatsoever. We cannot continue. So as discussed with our referee, Dr. Priya is being disqualified from the quiz. Okay, so let us move ahead. There is a very neck-to-neck competition ongoing amongst the top 5 or 10, I think. But those who are behind, don't worry. We have 3 more rounds to go. Before we begin, I would again request all the participants to please show their Kahoot device. Can I have that on screen? All the participants. Dr. Pavitra, Dr. Sahil, I can see. Dr. Bias is visible. Dr. Aditya is visible. Dr. Amit is visible. Okay. Dr. Manisha. Yeah. Dr. Saloni. Yeah. Thank you. Thank you all. Okay. So we'll begin with our round 3. So all the best to the contestants. Let us begin. Okay. So this round is truth shall prevail. Like we discussed yesterday, this is a rapid fire round. This will consist of 10 very fast questions of true and false. Okay. This will not have any bonus question or double point question. Only 2 options, true and false. Fastest to answer will get more points. Also, it will not have 30 seconds. It will only have 5 seconds to answer after the question is visible. Okay. So please keep that in mind. Okay, let us begin. Angelo Mosso is linked to pioneering of RTMS. True or false? Okay, so many of you, or I think most of you have correctly answered. The correct answer is false. Angelo Mosso is linked with fMRI. He was the first person to demonstrate the principle of on which fMRI is based. He conducted an experiment in which there was redistribution of blood flow and the scale tilted towards the brain when there was an active work going on. So on this, the principle of fMRI is based. So as this was the first question, we have discussed this. Now we'll be simply going on. We will not wait for the discussion. We'll discuss all the questions at the end. All right.
This is a rapid fire round. The time allotted in this round is lesser than the previous round. As you can see, only 10 seconds will be given. So be on your toes. Please continue, Dr.
5 to read the question and 5 to answer.
Number 2. True or false? Mefloquine has been contraindicated in those individuals with history of psychiatric disorder. Okay, next. The correct answer is true. Okay. We'll discuss the scoreboard later. True or false? Immediate need for gratification is a very commonly seen cognitive error in patients with OCD. True or false? The correct answer is false. Okay. Next question, please. True or false? Skin contact with fresh leaves of cannabis may lead to transdermal absorption of THC, leading to green leaf sickness. True or false? Okay, so the correct answer is false. Next question. The ALI rule takes into consideration only substantial capacity to appreciate the criminality of his or her conduct. True or false? Okay, the correct answer was false. True or false? Optogenetics is a biological technique to control the activity of neurons with light. We have 4 more questions to go. Number 7. In patients with apathetic thyrotoxicosis, apathy and depressive symptoms alternate with hyperadrenergic symptoms. True or false? The correct answer is false. Next. True or false? Maudsley method is a family therapy based therapeutic technique used in eating disorders. 5, 4, 3, 2, 1. So the correct answer is true. Most of you have got this one correct. The penultimate question of this round, number 9. True or false? Ulotaront is an emerging drug under trial for treatment of Parkinson's disease related psychiatric symptoms. True or false? Okay. So everybody is on their toes. There is an adrenergic rush and we have come to the last question of this round. It was fun to discuss this round as well. True or false? Peduncular hallucinosis results due to insult to midbrain and leads to vivid olfactory and tactile hallucinations. True or false? So correct answer is false. With this, we come to the end of our round number 3. The truth shall prevail. Now we'll discuss the questions. I think we have an organizing committee has something to say.
We see a tussle between Dr. Avijit and Dr. Biaskole. Now Dr. Biaskole has lost his lead. He is her lead. She is running second. Dr. Avijit has come into the lead. He is running in the top spot. I see Dr. Amit has raised 1 spot. Dr. Manisha has entered the top 5. And Dr. Vaibhav is running at the 3rd spot. There are very less difference of marks between all the participants. I think the top 3 spots are up for grab for everyone now. It is open. I request Dr. Varchasvi, can we move ahead to round 4? Because before that, we'll like to proceed with the audience round. Can I request Dr. Priyesh? Oh, discussion of this. Sorry. Please, Dr. Varchasvi, continue with the discussion of true or false round. Please continue.
Thank you. So I think most of you had an opportunity to get higher up the ladder in this round, and Dr. Avijit has grabbed that opportunity quite well. So we have already discussed the first question. The second question was mefloquine has been contraindicated in those individuals with history of psychiatric disorder. That is true because it can cause hallucinations, panic attacks, suicidal ideations. So these side effects occur with chloroquine, but more often with mefloquine as well. Hence, it is contraindicated. Number 3 was immediate need for gratification is a commonly seen cognitive error in OCD. That is false. The common errors include overestimation of harm, belief in being more vulnerable to danger, need for perfection and control, excessive focus to potential threats. These are much more common. Immediate need for gratification is not a cognitive error seen here. Number 4 was skin contact with fresh leaves of cannabis may lead to transdermal absorption and leading to green leaf sickness. So the green leaf sickness is a disorder which is seen in nicotine and due to tobacco leaves. So the correct answer would have been in context of tobacco rather than cannabis. The next question was ALI. ALI is the American Law Institute, also known as the Bronner's test. It takes into consideration not only the capacity, but also to conform their behavior. Let us say if someone has impulsivity and secondary to that, they are not able to conform their conduct or behavior. The ALI considers that as well. Next question is optogenetics is a biological technique to control the activity of neurons with light. That was true. Optogenetics is a technique to control the activity of neurons or other cells types with light. It has been introduced to map the functional connectivity of brain. Seventh question was in patient with apathetic thyrotoxicosis, apathy and depressive symptom alternate with hyperadrenergic symptoms. That was false. Only apathy and depressive symptoms are seen in context of apathic thyrotoxicosis. Thyrotoxicosis usually have hyperadrenergic symptoms, but not apathic thyrotoxicosis. Maudsley method is a family-based technique used in eating disorder. That is correct. It is a family-based model which is used in the treatment of anorexia nervosa devised by Christopher Dare. And it has 3 defined phases. The process is usually divided into 15 to 20 treatment sessions and may take about a year to complete. The penultimate question was ulotaront is an emerging drug under trial for treatment of Parkinson's. That is absolutely correct. It has been seen to be an agonist at the trace amine associated receptor TAAR1, and it is also useful in context of schizophrenia. So ulotaront is a new drug which can be used in schizophrenia as well as Parkinson's related psychosis. Last question was peduncular hallucinosis results due to insult to the midbrain and leads to vivid olfactory and tactile hallucinations. That is false. It causes vivid visual hallucinations which typically occur in dark environments and may last several minutes. Unlike other kinds of hallucination, they are very experienced as very realistic, vivid, and it involves the brain's midbrain, pontine, and thalamic lesions. So these were our discussion. This was our discussion for the rapid fire true and false round. Before we begin with our next round, I would like Dr. Priyesh to display the audience questions for round number 3.
The question for the audience in the YouTube chat box as well is, which of the following is not endogenous cannabinoid? Anandamide, virodhamine, 2-arachidonyl glycerol, or phosphatidylethanolamine? The question is also available in the YouTube chat box. Next question for the audience is, a person complains of hearing abusive voices when he hears the stairs creaking. What is the psychopathology described? The correct answers for the questions of the asked after the round 2 were, the first question was regarding the Cloninger 7-factor model. So the correct answer for that question was neuroticism, C. And the other question that was asked was regarding the risk factor of akathisia, which was not a risk factor on development of akathisia. And the correct answer for that question was D, vitamin B12 deficient.
We are analyzing the YouTube chat, and whoever has given the right answers will be declared at the end of the quiz for the audience rounds. And we are glad to inform that attractive prizes will be given to whoever are participating in the YouTube chat box in the audience round questions. So I request Dr. Varchesvi to go ahead with the round 4. Dr. Varchesvi, please continue.
Thank you, sir. So coming back to our finale, the penultimate round, round number 4, order amidst chaos. So it will have a variety of questions, a few setting preference, a few double or bonus points as well. So please be constantly vigilant. So let us begin with round number 4. So this is a puzzle, and for double points, you need to arrange it as per order proposed by Lawrence Kohlberg's stages of moral development from low levels to high. So low will come on top and high will come at the bottom. You need to arrange it, you need to drag it and put it in order, like we discussed yesterday. This is a bonus point question as well. Please keep that in mind. 5 more seconds. I think not everybody was able to finish this. Most of you have responded although. So the correct order is self-interest orientation, interpersonal accord and conformity, authority and social order maintaining, and social contract orientation. So basically this theory was devised to understand that even though moral reasoning is necessary, but for ethical behavior, it has 6 developmental stages. The first stage is the pre-conventional one, where the obedience and punishment orientation is seen, that how can I avoid that punishment. Number 2 is self-interest orientation, that's what's in it for me, paying for a benefit. Coming on to level 2, it is a conventional, which has interpersonal accord and conformity and the social norms, the good boy, bad girl attitude. Then the 4th stage is authority and social order maintaining. Then the 5th construct is social contact orientation, and lastly the universal ethical principle or the principle conscience, also kind of the ego ideal, which is developed throughout the life. Only 2 people have given the correct answer. Kudos to them. So I think Dr. Avijit and Dr. Avijit. Oh, sorry, Dr. Amit and Dr. Salmali have given the correct answer. Kudos to you. Number 2. This is again a puzzle. The correct order of management of akathisia as per Maudsley guideline is. So first line to last line, you need to arrange them top to bottom. First line to last line as per Maudsley guideline. So the time is almost up. Yeah. So only 3 people have given the correct answer. The correct order is low-dose mirtazapine, benztropine use, cyproheptadine, and lastly clonidine. So basically the correct order, first of all, begins with reducing the dose of the current antipsychotic. Then we can either switch to a lesser risk akathisia drug like olanzapine and quetiapine, followed by switching to propranolol. Then mirtazapine, which is the option given. Then the use of antimuscarinic agents like benztropine. Then followed by cyproheptadine use, and followed by benzodiazepine use, and lastly clonidine. So out of the given options, this is the correct order. Okay, we'll move with the next question. There are still many questions to answer. The puzzle question is the drugs used in PTSD in order of preference as per Maudsley guideline. The drugs used in PTSD as per Maudsley guideline. from first line towards the last line, top to bottom. So we have 12 answers with us. 13 now. Time is almost up. Okay, so the correct answer is paroxetine, then which is an SSRI followed by an SNRI, phenelzine, and lastly phenytoin, which is an experimental drug as well. And so this is the order. So first line usually, as we all know, that is an SSRI recommended at a maximum dose, that is paroxetine at 37.5. Second line involves agents like antipsychotics, MAO inhibitors like phenelzine and TCAs, and experimental drugs include duloxetine, lamotrigine, phenytoin as well. Next question, please. Again, a puzzle question. As per the study by Goatsman and Shields, morbidity risk of schizophrenia is from high to low. Highest risk of developing schizophrenia to the lowest risk. Arrange them in the order. All siblings, half siblings, children, grandchildren, whatever be the order. If a person has schizophrenia, what is the risk of development or precipitation of schizophrenia? This is a very famous study, also provided in Kaplan. So the correct answer is children, followed by all siblings, then half siblings, and lastly grandchildren. Okay, so coming to our midway of this round, fifth question. Arrange in correct order as per ICD-10 classification system of the disorders given. You need to start from F0 to F99, whatever be the order. As per ICD-10. In increasing order. So I think most of you have tried to provide us with the responses. The time is up. The correct response would be okay. So it's quite shocking to see that none of you could answer this correctly. Bulimia nervosa would be the first one, that is F50.2, followed by premature ejaculation, that is F52.4, followed by abuse of non-dependence producing substance, which is F55, and lastly F60.5, that is anencastic disorder. I think few of you might have gotten one arrangement order wrong. That is why it led to the incorrect answer. But despite that, let us move with the leaderboards first. So we have Dr. Avijit in the lead, followed by Dr. Salmali, Dr. Bias, Dr. Amit, and Dr. Vaibhav. Okay. So Dr. Salmali has come to the second podium position. And the next question, please. Question number 6. Arrange the following in order of MHCA chapters from first to last. Admission, discharge, and treatment, duties of appropriate government, central mental health authority, and nominated representative. From chapter 1 to whatever be the last chapter, you need to arrange them from first to last. Okay, 5 more seconds. Okay, so again, we have a very less correct answer respond. So basically the chapter number, could anyone tell me what is chapter number for the nominated representative, or what are the chapter numbers for these? Anyone would like to volunteer?
Please unmute your mic, and if anybody wants to answer this, please.
So it begins with chapter number 4, that is nominated representative. Then chapter 6, which is the duties of the appropriate government, followed by CMHA, that is chapter number 7, and chapter 12, admission, treatment, and discharge. Okay, the next question. So buck up all the participants. Question number 7 on your screen. Arrange the antidepressants on the basis of their propensity to cause sedation from high to low. From high to low. Clomipramine, tranylcypromine, amitriptyline, nortriptyline. So highest sedation from lowest to lowest sedation, top to bottom. Okay. 10 more seconds. So the correct answer would be amitriptyline, followed by clomipramine, followed by nortriptyline, and lastly tranylcypromine, which has the least sedation. Only 3 people have gotten this response correct. Moving on to the next question. The third last question for this round. Question number 8 on your screens. Arrange the correct on the basis of ability of drugs to cause 5-HT2 blockade, highest to lowest. Droperidol, chlorpromazine, flufenazine, quetiapine. Highest to lowest. It has a combination of both first generation and second generations. Please keep that in mind. Droperidol, chlorpromazine, flufenazine, and quetiapine. So the time is almost up. So the correct answer would be chlorpromazine, followed by droperidol, followed by quetiapine, followed by flufenazine. We haven't received any correct response for this one. Chlorpromazine has one of the strongest propensities, even though it is a first generation. It is a relatively different drug from its own class. And quetiapine, despite being a second generation, has significant 5-HT2 blockade. And lastly, flufenazine. Okay, coming to the second last question of this round. It is a slider question. Number of stages in the strange situation procedure devised by Mary Ainsworth. You need to put the slider on the most appropriate number. Number of stages in the strange situation procedure. You need to click on submit as well. Please remember, after you have put the correct answer, click on submit. All the slider questions needs to be submitted as well as the multiple choice ones. Okay, so the correct answer is, it is giving us a vibe of Das Kadam. The correct answer is 8. That is 1 greater than Thala. That is number 8, devised by Mary Ainsworth. Okay. Last question for this round. All foot on the paddles. It is again a slider question. Click the correct number of cards in thematic app perception test and need to click on submit as well after you have chosen it. Number of cards in TAT. Okay, we have received 10 answers. 10 more seconds to go. Okay, so the correct answer here is 31. So 30 cards and a blank card, that comes to be 31. Only 4 people have correctly responded this. And this brings us to the end of our penultimate round with Dr. Avijit in the lead, Dr. Amit at the second podium position. Dr. Simranjit has come up to the race at number 3rd in the podium. Dr. Bias, who was leading earlier, is still in the race and is at the number 4th position, and Dr. Pavitra is at number 5. Still one more round to go, and we have the rest of the contestants as well in a very close neck-to-neck competition. Let us begin. Before that, I would like Dr. Priyesh to get on with the audience questions. You can have a breather for a minute.
So the question for the audience on the YouTube comment, in the YouTube comment boxes, fusion beliefs are seen in OCD, depression, schizophrenia, or anxiety disorders. Fusion beliefs are seen in. The question is again in the comment box as well. It's meant for the audience. Our next question for the audience is, poor recognition of the emotional expression of others is known as. Poor recognition of the emotional expression of others. The question is again in the comment box along with the options.
5 and 6.
The options are receptive aprosodia, agnosia, motor aprosodia, and asomatognosiia. And the answers for the audience questions that were asked at the end of the third round were, the question, first question was, which of the following is not an endogenous cannabinoid? The options were anandamide, virodamine, 2-AG, and phosphatidyl ethanolamine. The correct one was PE, phosphatidyl ethanolamine. Another question that was asked was, a person complains of hearing abrasive voices whenever he hears the stairs creaking. What is the psychopathology described? The correct answer here is functional hallucinations.
Okay, before we begin with our next round, I would like the participants to please display their Kahoot device. Dr. Pavitra, Dr. Sahil, Dr. Vyas, Dr. Aditya, Dr. Amit. Dr. Pavitra, it's not visible and your face is not visible as well. Yeah. Dr. Sahil, I can see that. Dr. Vyas is seen, Aditya is done. Okay, Dr. Vabhav, Dr. Salmali, okay, correct. Dr. Simran, could you please show it again? Yeah. Dr. Saloni, okay. Dr. Manisha, fine. Dr. Kashyap, your video is not visible. This is your first and last warning. Please switch on your video. Okay, yeah. Dr. Jaswant, Dr. Avijit, and Dr. Dhwani. Dr. Dhwani, can I see your screen, please? Yeah, thank you. Okay, so this brings us to the end of our journey. That is the fifth and the last round. After a huge colossal battle of the titans, you have reached here, and whatsoever be the result, you are all winners for us. You have did very well, and still there is a chance for anyone to come up to the podium place. This round has been designed to incorporate various aspects of psychiatry. That is the ultimate jukebox. This may have different types of questions, MCQ, arranging order, true, false, whatsoever. So just please keep in mind what is the type of question and then answer it accordingly. We'll begin with our last and the ultimate round of this finale. Can we have the first question, please? On your screens. Halstead Return battery includes all of the following except Wechsler intelligence scale, trail making, seashore rhythm test, and Ozeretsky test. Fastest to answer, greater the points. All right, all of you have answered. So the correct answer here is the Ozeretsky test, which is a type of test for the motor proficiency. Rest all are part of the Halstead Return battery. And it is also seen in Ozeretsky test is a part of the soft sign of schizophrenia where the motor deficits are seen. So Simranjeet is again back with the answer streak of 3. Let us begin with our next question. We don't have safety slides here. The term 4-day mu means. The term 4-day mu means. The options are as follows. MCQ type question. Five more seconds to go. We have almost all the answers with us. Okay, so the correct answer is choosing homosexual relation when partner of opposite sex is not available. Psychiatry basically means for want of anything better. या फिर हिंदी में बोले तो कुछ नहीं से कुछ भला. It is very rare condition and seen especially in the Western culture, and It means choosing a homosexual relation when the partner of opposite sex is not available. It does not relate to being homosexual in orientation or being transgender or gender identity crisis. It's simply a lack of availability and supply. Yeah. Number 3. It is a MCQ. The term brain fingerprinting refers to mapping of brain areas through neuroimaging, postmortem neuroimaging for assessment of function, type of personality assessment based on cognitive capacity, a lie detection test based on ERP. Ten more seconds. Okay, so only less than half of you have gotten it correct. It is a lie detection test based on ERP. It basically, ERP is the event related potential. We connect the patient with EEG and we try to monitor any ERP. When a question is asked and the answer is being truly responded, we'll have different types of ERP. However, if the person is trying to change or confirm any information, different types of ERP is seen. It is a test which is used by forensic people and only after the law has validated it. Similar to the polygraph test, it needs validation or order from the court of law, and it is not used as an absolute evidence. It is a supportive evidence. Okay, the next question. Consider following statements regarding lasmiditan and choose the correct answer. The options are, the questions is to be read in the image: partial agonist of 5-HT2, selective agonist of 5-HT1F, significant elevation of liver enzyme, and can be used in patients with CAD. So you need to choose which is incorrect. The incorrect answer. Okay, so lasmiditan has recently quite well promoted. It is a drug to be used in acute migraine and it is correctly a selective agonist of 5-HT1F and can be used in patients with CAD. However, it is not a partial agonist at 5-HT2 and elevation of liver enzymes is not that common. Okay, coming on to the fifth question. Incorrect with response to the respect to purple hat therapy is: purple hat therapy combines established medical therapy with new element. EMDR is a type of purple hat therapy. The term was coined by Francine Shapiro and claimed to be effective because of the new addition. Okay, we almost have all the answers. So the correct answer here is the term was coined by, that is the incorrect one. The term was not coined by Francine Shapiro, which is linked to EMDR. Purple hat therapy basically refers to any medical practice in which an established form of therapy is mixed with an unlikely new addition, and then it is claimed to be effective. Let us say I have a very effective drug, valproate, which works very well in mania, and I add to that a drug, let us say clonidine, okay, which is not very well established in context of mania, and I try to see a response when I add it to valproate. Obviously, there may be a set of patients which will respond well because they are responding well to valproate. And I try to hypothesize that, okay, because I added clonidine, these patients got well. So this is incorrect hypothesis and conclusion, and that is what refers to the purple hat therapy. And Francine Shapiro is credited with the discovery and devising the EMDR therapy, which is quite often referred as a purple hat therapy by a few in context of psychotherapy. Okay, yeah. The next question. Before that, we have the leaderboard with us. So Dr. Avijit is leading with a score of 20,000. Dr. Amit is in the very close second lead. Dr. Simranjeet is on fire with a 3 correct answer streak. Dr. Bias is still in pursuit with 18,000 marks. And lastly, Dr. Pavitra is in the top 5 with 17,790 points. Still 5 more questions to go. I request all the candidates to be as vigilant and as fast to answer they can be. And we have around 5,000 marks barring the bonus question. So let us begin. Correct statement with respect to mirror neurons. Originally isolated from F1 sector of ventral premotor cortex linked to posterior occipital slow waves of youth, has a role in theory of mind, isolated from superior parietal lobule. I think most of you have responded to this very fast. Okay, so the correct answer is number C, that is has a role in theory of mind. It was originally isolated from the F5 sector in the macaques, and it is linked to the mu waves rather than the posterior waves of youth, and it is thought to be in the inferior parietal cortex. It is still debatable that mirror neurons exists in humans or not, but definitely there have been substantial evidence, and they are linked with various disorders of childhood like autism and the pragmatic disorders, even learning disabilities. So this is the correct one, that it has a role in theory of mind, okay, which is quite often disturbed in autism as well. Next question, the 7th question, learning to walk in a straight line despite the motor impairment produced by alcohol intoxication can be explained by, in an alcoholic, condition tolerance, reverse tolerance, behavioral tolerance, pharmacodynamic tolerance. These are the 4 options. Person learning to walk in a straight line despite the motor impairment. Okay, so only around half of you have correctly answered. That is a behavioral tolerance. This is not a fear of police or the wife at home. This is actually a process where a person starts to learn despite their motor deficits, and it is a behavioral tolerance. Now coming to the third last question of this round, all candidates buck up for the next question. Dr. Abhijit is still in lead, followed shortly by Dr. Amit and Dr. Simran. Okay, so the question here is, which of the following is not a variant of transference? The options are narcissistic transference resistance, libidinal transference, and psychotic transference. Okay, so the correct answer is transference resistance. Here, all the rest, including others like transference of defense, narcissistic transference, self-object transference, they are a variant of transference, whereas transference resistance means resisting transference or trying to get better irrespective of actually being better in context of psychotherapy. So the next, before we move on to the next question, can we have the leaderboard, please? So Dr. Amit and Dr. Abhijit are almost neck to neck. Dr. Simran at a close third. Dr. Bias and Dr. Vaibhav are in the top 5. Dr. Amit is also on an answer streak of 5 correct questions. So coming on to the 9th and the penultimate question of the finale. Let the adrenergic rush help you out as well. Which of the embryonic structure gives rise to neurons? Neural tube, neural crest, ectoderm, mesoderm. Going back to the roots of anatomy and embryology. Okay, we almost have all the answers, and the correct answer is ectoderm. So during the embryonic development, the 3 germ layers, ecto, meso, and endoderm, are responsible for most of the development. The skin and nervous system is developed from ectoderm, the gut from endoderm, and rest of the visceral organs from mesoderm, right? So the correct answer here is ectoderm. Okay, The leaderboard will be displayed after the last question now. Okay. The last question for double points. Which of the following is correct in context of Gorman syndrome? The options are due to injury of a parietotemporal lobe, characterized by sudden sleep bouts during sexual activity, associated with obsessions about gourmet food, and presence of gustatory hallucinations during stressful situations. 15 more seconds for the last question. I think many of you have taken a sigh of relief, and the correct answer is it is associated with obsessions about gourmet food. So this brings us to the end of our finale. Well played, well prepared, all of you. First of all, a round of applause for everyone who has given us this great experience of the finale. Now coming to the leaderboard. Just a minute, please. Before we declare the results, we can have the last round for the audience questions. Questions and answers both. All right. Okay. Over to the organizing team.
So the question that was asked during the last round to the audience was fusion beliefs are seen in. The correct answer is OCD. And another question that was asked, poor recognition of emotional expression of others is known as. And the correct answer is receptive aprosodia. We also have a few winners from the audience. Will be given some kind of.
We'll be giving gifts, goodie bag to the winners in the audience round. Do we have the results? Yeah, so Hitavi Desai and someone by the name of Siddharth. These are the two winners who have answered the most number of questions in the audience round. Could we please have their numbers or their addresses, or somehow if they can contact us? We would want you to give us to give you gifts. So could you give us our details, please?
The email given.
Either on the chat or on the email.
Email provided. Email mein likh deta hoon.
Okay. Yes, sending the email on the chat box. Kindly give your details, please. Thank you for being a wonderful audience. There was an overwhelming response from the audience in our YouTube chats. It was a very nicely conducted quiz by our grand quiz master and quiz master, Dr. Varchasvi and Dr. Priyesh. I congratulate them for successful conduction of this quiz. So do we have our referee with us, please? Dr. Swayam, are you there with us? I think there is some problem with her internet connection. So we'd like to proceed with the winner list.
Just a moment before we share the results.
We're discussing with our referee. Please bear with us for a moment, please. We'd like to stop for 1 or 2 minutes. Thank you. Sure.
इसको हटाइए ना, अपन बैक करके वापस से एनिमेशन।
Do we have Dr. Swayam with us, please? Our referee? Yes. Dr. Swayam, are you with us?
Yes, sir. Hello, sir.
I would request our referee to kindly declare the results, please. As shown on the slide. Dr. Swayam, is it visible to you?
I can see the question, last question.
You're not audible, Dr. Swayam. Dr. Swayam, your voice is not audible.
Am I audible now?
No, it's
Hello?
the volume is very less.
Without headphones, if you
Can you try without the headphone, please?
Okay.
Or if you permit, can I do it on your behalf?
Yeah, sir. Go ahead.
Okay. So with the permission of the referee, I would like to declare the results now. At the third spot, all of us have, all the participants have played really well. It was a really tough fight between all the participants. In between, Dr. Kole was leading. There were other participants which were up and again in the top 5 list. Really close fight. But at the third spot, we have Dr. Simranjeet Kaur from
LHMC.
From LHMC. I congratulate Dr. Simranjeet. Very well played.
Sorry, sir, it's RML Hospital, New Delhi.
Hello?
Sir, it's RML Hospital, New Delhi.
Sorry, from RML Hospital.
It's okay, sir.
Congratulations, Dr.
Thank you, sir.
Simranjeet. You secured the third spot. At the second spot, we have Dr. Avijit Batra from SMS Jaipur. Congratulations, Dr. Avijit. You were in the lead. You were playing really well. But there are different luck at different times. So but you really played well. You were really on a winning streak in between. Really well played, Dr. Avijit. I think you are a well-learned and you're going to be a great psychiatrist. Dr. Avijit, do we have you with us? Congratulations.
So for such good words, I'm really grateful for.
So it helps to be a gourmet
Yes, sir.
at times.
Okay. So now declaring our winner from Riva Medical College. Despite all odds, initially not being in the top 5, he got a chance because he was initially in the waiting list. One of the participants had dropped out, and that is how Dr. Amit got in the top list. He showed his mettle well. He secured the top 5 spots from round 2 or 3 onwards, I guess. And then he really steered his way through. Dr. Amit, congratulations. You are the final winner of CEREBRA 2024, gold medalist of CEREBRA 2024. Dr. Amit, do we have you with us? Can we have a few words from you, please?
Thank you so much, sir. Actually, originally I was in the waiting list. I wasn't expecting to be in the part of the final screening round, and I was given the opportunity to attend the final round. And thank you, the organizing committee. And it was a really tough competition, and I wasn't expecting that I would slowly climb the ladder, but really, it was a neck-to-neck competition. I thank you so much for the committee. And hello, I'm audible?
You're audible, Dr. Amit.
So I
It's
thank
given
my,
full time to you to speak. You are the gold medalist. Please say your heart out.
I thank the HOD, Dr. Pal sir, and Varchasvi sir, PS sir, and Dr. Our HOD, Dr. Nimisha ma'am. She always teaches us and guides, and she encouraged me to take part in the quiz. As I was a bit down, as I was qualified for this earlier, I didn't was not able to take part in the screen final round. I was in the waiting list, but I was given chance in the final round. I really thankful to the committee, and I congratulate all the winners from my side.
I think Cerebra would have missed this gold medalist had you not been in the top 15 participants.
Sure. Yes.
Really well played, Dr. Amit. Really well played, all the participants, I would say.
Yes, sir.
Can I request our referee to kindly say a few words, please, about the quiz? Thank you for being a sport. Thank you for agreeing to be the referee in Cerebra 2024. Dr. Swayam, do we have you with us?
Yes. Am I audible now?
Yes, sir. Yes, you are. Yes, you are. You're audible now.
Thank you. I am always happy to be associated with the Medical College Psychiatry Department as an alumni of this. And this is a very proud moment for me because SSM CEREBRA was the place where I worked as an SR. And a lot of CIPNs, that is from where I did DPM, are here. So it was very fun watching the quiz and being the referee. I congratulate all of you. Winning is important, but participation is more important. So all the participants, it takes courage to participate in a national level quiz. And I congratulate all of you equally. And of course, the winners are winners, but all of you are doing very good, and all the best for your future.
Thank you, Dr. Swayam.
Thank you, sir.
Thank you, Dr. Swayam, for being a part of
Thank you,
Cerebra
sir.
2024. We are delighted to have you. We are
Thank you,
lucky
sir.
because you could figure out time from your busy schedule. Thank you so much. Can I request
you,
Dr.
sir. Welcome.
Varchasvi to kindly say a few words, please? Our quiz master.
So thank you so much, sir. I just want to take you all through this journey once again. Just a small recap. We had begun with this first installment in 2022 with Cerebra's initiation, and since then we have come a long way. Since this is not a quiz which is sponsored by anyone, we simply tried to give you a pure scientific fiesta, and it has been sponsored by our department. We thank our respected head of department, Dr. V.S. Pal sir, and along with that, our gracious moderator and quiz master, Dr. Rahul Mathur sir, under whose guidance we were able to conduct such a great national level quiz. We had participation from pan India, almost more than 25 states and union territories, and it was a great experience, I think, for the participants as well as for us. There were a few technical glitches in the screening round, which we tried to avoid in the finale, and we will keep that in mind for our next iterations as well. And we hopefully will want to meet you all in different phases of our different editions or through some other scientific community level as well. Now I hand over the presentation to Dr. Priyesh, who would like to say a few words as well. Thank you.
So first of all, I would like to thank our department HOD, Dr. V.S. Pal sir, for providing us with this opportunity to organize this quiz. Then I would like to thank my colleagues, our team, Dr. Rahul Mathur sir and Dr. Varchasvi sir, for organizing this quiz. But any quiz is not successful like it's not successful just on the basis of the organizing team, it's on the basis of the participants. So the role also goes to the participants for making this a very fun event and an infotainment event, for making it successful. I also thank the audience for their presence, for their interactive participation on the YouTube comment box or during the screening round as well. I thank you all. We'll be sharing the results, all the positions on your mail, and we request to, if you want to provide your feedback, you can do so on our official email ID. I request Dr. Rahul Mathur to take the podium.
This we have come to the end of CEREBRA 2024. I think you know about the prizes. The top, the gold medalist gets cash prize of 10,000 rupees. The silver medalist gets a cash prize of 5,000 rupees and other goodies. And the bronze medalist, third place winner, gets 3,000 cash prize. All the participants will be receiving a participation certificate.
Consolation prize for fourth.
And there are consolation prizes for 4th and 5th spots as well. I congratulate all the participants, all the winners. I would also take a moment here to thank all the 225 participants that we have had in the screening round. Thank you so much for making CEREBRA 2024 a huge, big success. On behalf of Dr. V.S. Pal and Department of Psychiatry and my colleagues, Dr. Varchasvi and Dr. Priyesh, I would like to thank everyone involved in making this event a success. Thank you, everyone. Thank you for joining us. Thank you for being here. Have a nice day. Have a great year. Bye-bye.